Hello viewers, welcome to another day for enlightenment. Today we are looking at health tips with Dr. Suleiman, who is going to be drilling us on how to avoid or prevent heart failure, and also how to take care of your kidney, how to prevent hypertension, and also how to reduce some excess sugar in the blood that might result to diabetes. And don't forget to like, share, comment, and follow our channel so that you will be the first to get updates on health tips and mystical encounter that are happening in our society today. So let's dive in straight into the video.
What are you going to do when you have heart failure? Remember, edema is something that we see not only in heart failure. Ascites we see not only in heart failure, but we also spoke before about liver issues. That liver, but this is for a different reason now. But at the end of the day, you have a patient with edema, you have a patient with ascites, you have a patient with leg swelling. That mean it could be heart failure. But the minute you put your probe, the minute you look, you scan the patient, in the first 1 minute you already know the problem, if it's the heart or not, because you're going to see the contraction of the heart and see with any valve problem or any issue like this. But most likely you will be able to evaluate the patient in the first 1 minute to tell if the heart is okay or not. Those patients who come with the complaint, I cannot breathe, difficulty in breathing. Some of them is just simple gastric, which is really, not a big deal. But others is a problem. This is the number one complaint that brings the doctor attention to heart failure. I cannot breathe, doc. I find it difficult to breathe. That's a sign of heart failure. Could it be a sign of something else? Yes, it could be. It could be a sign of something else, but the most common things, we're talking about the heart today, so the most common complaint, the number one complaint of those with heart failure is shortness of breath. I cannot breathe, doc. We may have edema. Edema meaning, remember when I told you about the water? Let's talk about the water for a second. With the water you drink, is it good to drink a lot of water? It's good, as long as you are healthy. So that's it. Water is number one medicine, is your number one doctor. Water is very essential. So what is the best time to drink water? As soon as you wake up. Why? Because it eases the digestion through the day. Why else? Because when you sleep, your heart goes slow, your circulation goes slow, because now you're in one position, you're not moving anymore, so the blood tends to stand, somehow much slower than when you're moving. So that invite formation of clots. And also, if you're not moving and you're sleeping and the circulation is not very active like when you're up, that means the pressure will drop. So when you sleep, your blood pressure is lower than when you're active and walking and working and going here and coming there. So that is normal. So what is the best advice for that is I drink some water early in the morning. That will bring the pressure back up. Okay, that will bring the pressure back up and also will ease the digestion for the remaining of the day. I have to say something here. You know that because of that fact that the circulation is slow, the heart is getting slow because you are sleeping and the blood is very much stand still. Almost, it cannot be stand still mean death, but almost is let's put it in a better term, is slower than normal. And that's when things are slower than normal in our system, that means that this is an invitation for clot formation. So have you ever noticed that those who have a stroke, it's only in the early hours of the day, 4 o'clock, 5 o'clock in the morning? We know why? For the same reason I just told you, because the circulation is very slow when you sleep. So that's an invitation to have a clot, when you sleep. So if you get up at 4 o'clock, 5 o'clock in the morning, walk to the fridge, drink a glass of water and come back, you solve the problem.